Okay, excuse me, good afternoon. Welcome to the Thurston County Board of Health meeting for Tuesday, March 22nd, 2022. It's 4:33 p.m. We apologize to the public that have been waiting for this meeting. We had two public hearings and a board meeting that just kind of follow from each other, and we're ready to get going. 4:33 p.m. My name is Ty Menser, Chair of the Board of Health. To my right is the Vice Chair, Commissioner Carolina Mejia, and to my left is Commissioner and Board of Health member Gary Edwards. The County Manager, Miro Chavez, is here, our Clerk of the Board, and he's serving today as in the stead of the Interim Public Health Director, who's not available for today's meeting. The Clerk of the Board of Health, Amy Davis, is here, and we have our County Health Officer and other key staff members on the Zoom. This is a hybrid meeting. Okay, so with that, we're calling this meeting to order, and I would ask for a motion regarding approval of today's agenda.
I would move to approve the agenda for Tuesday, March 22nd, 2022.
It's been moved and seconded to approve this proposed agenda for today's meeting. Any further discussion?
No, sir.
No, sir.
Call for the vote.
Commissioner Mejia.
Aye.
Commissioner Edwards.
Aye.
Commissioner Menser.
Aye. That motion carries. Today's agenda is approved. Next is consideration of meeting minutes from February 8th, 2022. Is there a motion? Or any further question about?
I would move to approve the meeting minutes from February 8th, 2022.
Second.
It's been moved and seconded to approve meeting minutes from February 8th. Any further discussion on that motion?
No, sir.
No, sir.
Call for the vote.
Commissioner Edwards.
Aye.
Commissioner Mejia.
Aye.
Commissioner Menser.
Aye. Motion carries, and we have approved meeting minutes from February 8th. Next is our Proclamation and Presentation section. This month we are considering a proclamation for Developmental Disabilities Awareness Month. And Mark Moffitt, from our Community Program Manager from Public Health and Social Services, is here to give us kind of an overview of what this is about. Mark, good afternoon.
Well, good evening, Commissioners.
Not quite, almost. We'll get there.
I am Mark Moffitt, Program Manager at Public Health and Social Services. This month is Developmental Disabilities Awareness Month. And it's a perfect time to highlight some of the great contributions that people with developmental disabilities are doing in our community every day. It's also a great opportunity to point out how our local providers assist with employment, personal relationships, recreation, transportation, self-advocacy, and so many other activities that help people with disabilities meet their individual goals. Today, I invited one of those providers to discuss their efforts in providing support for people with disabilities in our community. Jonathan Plager is the CEO of Morningside. Morningside has been in Thurston County for over 50 years, providing various supports for people with disabilities. Jonathan?
Great, thank you, Mark. Good afternoon, commissioners and staff. Thank you for the opportunity to present, and thank you for the opportunity for this proclamation to raise awareness for individuals with developmental and intellectual developmental disabilities. Inclusivity in the community is our main focus. Morningside is focused on employment specifically, and we've been really excited since the pandemic is waning here to help other individuals get out there and get employed in the community. During the pandemic, there was a lot of furloughs, a lot of folks with disabilities lost their jobs just because of the shutdown. That's changing now since the pandemic is waning and shifting, and we're excited about that because there's a need for so many employees, so many workers out there for different businesses and government entities, and we're helping to fill that need and helping to get individuals good, high-paying jobs and get connected in the community. Work is really important to people of all abilities, and especially folks with disabilities, because it just helps them connect to the community, helps them have that social network, but also really helps them connect to give back to the community through that work. So we're excited to help those individuals do that. We're also excited by some of the more recent legislative actions that happened during the last legislative session to strengthen the supports and opportunities for students with disabilities to get supports earlier and sooner in their high school careers and help them transition more successfully and quicker once they graduate and into the work world. So the school to work, statewide school to work efforts that were passed is just a great boon for students and will help us have those successes earlier with students. There are a lot of studies show that the sooner we can start working with students and figure out what they're interested in doing for work and what their skills and abilities are, really helps them succeed later in life and quicker too. So we're excited about that and all the other opportunities post-COVID. So thank you for bringing awareness to this, to these efforts and to promoting inclusion in our community. Thank you very much.
Thank you, Jonathan. Morningside has been great at helping people with developmental disabilities be productive and independent as much as possible. And they've just had a great history in our county doing that. And with that, that's all I have today.
Any questions or comments from the board for Mark or Jonathan?
No, I really don't have any questions, but I would like to thank both of you for the work you do with that group. Get those folks to be productive citizens in our community. Thank you very much.
Thank you very much.
No, just a thank you for all you do, and I'm ready for a proclamation, sir, whenever you're ready.
Ready to go. Thank you.
Okay, so proclamation. Developmental Disabilities Awareness Month. Whereas Thurston County Public Health and Social Services is involved in advocating for programs that promote positive system changes, allow persons with developmental disabilities to achieve optimum independence, and promote innovative programs and practices that improve the quality of life for people with disabilities. And whereas Thurston County encourages all citizens to actively participate in events that appropriately recognize and celebrate Washington's diverse population, including persons with developmental disabilities. And whereas in Washington, approximately 83,000 adults and children have developmental disabilities, and a majority of these individuals are primarily or solely supported throughout their lifespan by their families. And whereas people with developmental disabilities share with all Washingtonians the desire to achieve personal success through education, meaningful work, and family and community ties. And whereas Thurston County is committed to recognizing that every person, regardless of perceived ability, has valuable strengths, infinite capacity to learn and make decisions, and the capacity to make important contributions to their communities if given opportunities to do so. And whereas it is necessary that local communities in Washington, such as Thurston County, support the mission and purpose of Developmental Disabilities Awareness Month and encourage their citizens to recognize and respect this important commemoratorium. And whereas we acknowledge Washington state leadership and public policies accomplishments concerning persons with disabilities in employment and their quality of life, and in identifying improvements to public policy that facilitate full inclusion of Washington citizens with developmental disabilities and their families. And whereas Washington state leads the nation with 87% of individuals with developmental disabilities in county managed employment and day services participating in integrated employment compared to 24% nationally. Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims March as Developmental Disabilities Awareness Month in Thurston County and calls upon all citizens, communities, state agencies, and elected leaders to increase public awareness of the needs and potential of individuals with developmental disabilities, and to recognize that persons with developmental disabilities are vital and vibrant members of our communities. Adopted this 22nd day of March 2022, the Board of Health.
All right.
Thank you, commissioners. Thank you, Jonathan.
Thank you, Jonathan. Thank you, Mark. Appreciate it.
Thank you all. Thank you very much.
Okay. Next would be opportunity for the public to address the Board of Health. Commissioner Mejia, did you want to address the inaccuracy that you identified in the minutes?
Yes. So just to bring back, I was looking at the minutes, and it says that I am the commissioner and that it's Vice Chair Edwards. So I was wondering if that's the case.
I would entertain a motion to amend the minutes to just change those designations in section 6, if you wanted to make that.
Well, I'm not sure if he's, I wouldn't want to.
Well, it said, if you look under section 1, you're listed as vice chair, so there is a discrepancy.
Okay. Okay.
Nice try, Commissioner.
I'm going to help you as much as I can.
Really?
Commissioner Edwards is the vice chair.
Commissioner,
Really?
Commissioner
Okay, and
Edwards, I
then-
will support you as much as I can.
So
And the reason it's-
Amy just showed me the boards, commissions, assignments that you approved. So I stand corrected. Commissioner Edwards is the
You
vice
know,
chair.
I have to say, we went over that, several times, this and
Yeah.
this, and this would work, this won't,
So,
back and
My-
forth.
my
I can see why
apologies.
that happened.
so Commissioner Mejia just read the long proclamation on
I
your behalf.
know.
Thank you, Commissioner.
So
You did well.
may I ask, was the February meeting where we approved the assignments?
Assignments.
So there is no inaccuracy because at the time,
Okay.
you were the vice chair to begin with. We changed during the meeting and then it was Vice
Yeah.
Chair Edwards. Okay, so the minutes are accurate.
Okay.
Now we know exactly what
So
we
I
approved.
was the one who created the confusion. So my apologies.
You know, I want to take this opportunity, though, to let the public know that may be watching this meeting today. We serve on so many boards and commissions and bounce back and forth in different roles. It's obviously hard to keep it all straight sometimes, even for ourselves, as we're trying to designate who might be able to attend, when, which days, which position, and so, anyway. Well, I'll accept that help when the time comes, okay? Okay,
County Manager, we have no one in the boardroom and there's a Derek, I can't read the last name.
Yeah, I believe is Mr. Derek Lesser.
Is that
Like to put
Lozier.
testimony this afternoon.
Yes, hello. I am Derek Lozier. I'm counsel for Thurston County in the ongoing opioid litigation.
Oh, okay, so
Okay.
no public testimony, sir.
I asked in advance because I'm not going to go through all the parameters and rules of public comment if there aren't any public commenters. So with that, I'm going to move on to item 4, which is the prescription opioids litigation update. We have Scott Cushing, Senior Deputy Prosecuting Attorney from our Prosecuting Attorney's Office, to kind of bring us up to speed. I know sounds like there's been some development, so I'm excited to hear where we're at.
Thank you, Commissioner. Good afternoon, all of you. I am Scott Cushing. I'm with the Prosecuting Attorney's Office here, and I'd like to introduce Derek Lozier, who is a senior partner at Keller Rohrbach. And Keller Rohrbach is representing Thurston County and dozens of other municipalities in this lawsuit. And we filed it back in 2018 against opioid manufacturers and distributors. Those folks have profited from their deliberate and systematic practice of providing false and misleading information to doctors and patients about the safety of prescription opioids. This is a nationwide lawsuit, which you've heard about in the past with many, many parties. And Derek can give you a high-level overview of where things are at today. So with that, I'll hand it over to Derek.
Thank you, Scott. And that was a good introduction to the litigation. It has been ongoing since 2018. The cases, as often occurs when many cases are filed against the same group of defendants, the cases are all consolidated before a single court in the Northern District of Ohio, where they've been proceeding since 2018. There has been an enormous amount of work done on the litigation. The way this type of litigation is set up, once it's consolidated, the court selects certain jurisdictions to serve as bellwether trials. There have been 2 bellwether trials, one in the Northern District of Ohio, another was sent to West Virginia, and those cases are concluded. There's awaiting judgment in the West Virginia case. In the Northern District of Ohio litigation, the trial that occurred was against the national retail pharmacies. There was a verdict for the plaintiffs, and now that litigation has moved on to its next phase, which is really the remedy phase, which will be happening soon. While that's been happening, the court in Ohio has sent different cases to different locations around the country for additional bellwether trials. And so there's a lot of work being done on those cases. There is one large national resolution with the claims against the distributor defendants in Johnson & Johnson. Washington State, it's a pretty complicated structure, but Washington State opted out of that resolution. And as a result, all the local governments participating in the litigation are also opted out. Washington State is in the midst of its own trial against those distributor defendants, and that's ongoing now. And so we'll have to wait and see what happens there. But the litigation is ongoing. It will be ongoing for probably quite a bit longer against the remaining defendants, which are the national retail pharmacies, a couple of the manufacturer defendants that are still in the case. And so that's kind of the big picture. Just the last detail for you, there have been a couple of bankruptcies in the midst of the litigation. Purdue Pharma sought bankruptcy court protection. That bankruptcy plan is proceeding. There's been a fair amount of litigation over that plan. And Mallinckrodt, which is another manufacturer defendant, they sought bankruptcy court protection, and the bankruptcy proceedings are ongoing. This case has been described by some as the largest and most complicated litigation in American history. And I can tell you that after several years of this, that seems about right.
Thank you, Scott. Scott, anything you wanted to add before I ask? We can turn
No, nothing further. I know that it's been long and arduous, and Keller Rohrbach's doing great work on our behalf.
Questions for council, Commissioner Mejia.
Yes, I do have a question. It's regarding kind of how that allocation will work on in the future. I went to the Washington State Association of Counties yesterday, where they talked about the 183 that got that the state is going to get, and it's going to be kind of allocated to all the different counties. And it was, I believe, like based on population and the harm, and I think those were kind of what they were looking at. And I was just wondering if we've heard back anything on that, or have a guess on what Thurston County might get.
Sure, there are a couple different things going on, some of which are public, and so I can talk about them, and others are not. So perhaps there can be, if necessary, an executive session of some sort. I believe what you heard about the other day was the allocation procedures for that came out of the Purdue bankruptcy plan. And for that, there's an arrangement that controls how the funds will flow into the state and to local government within the state. And there's an allocation system that got worked out through the bankruptcy process that applies to all states across the country and all local governments within all of those states. We can do the math and try and figure out what the amount of money would be. It's a little bit in flux because of some litigation still going on over the contribution to the plan by the Sackler family. The Sackler family is the family that owns or owned Purdue Pharma. And so that there is a plan, though. There is an allocation agreement that is public. You can see that plan. You can see how the flow is described and how the money is divided between the state, what portion the state keeps, and what portion will flow through to local government. The one other detail worth noting about that is that there is an approved list of what's referred to as abatement purposes. And so it was very important in negotiating the Purdue plan, and this will be the same for any subsequent resolutions in the litigation, that the funds can only be used for purposes that relate to abating the opioid epidemic. And it's a pretty broad list. I think there's probably something on that list for anyone with any interest in the variety of programs that are appropriate for abatement. But they cannot be, the funds can't be used for purposes that stray from that list. That was an important part of negotiating the allocation agreement. In terms of future settlements, there will need to be an allocation agreement worked out. that will both determine how the funds are shared amongst jurisdictions in the state of Washington, and also how the funds are shared with the state. And that's all a work in progress.
Thank you. Can I ask one more question? My next question's in regards to, again, with that allocation, but we also heard that some other states are not happy that we got such a high number or more than they did, and that they might appeal that. If that happens, I mean, is that something that basically we won't get to see any of that funding?
And again, I think you're referring to what's going on in the Purdue bankruptcy, and the big picture there is the state of Washington, along with a few other states, challenged the bankruptcy plan and believed that the Sackler family should contribute more funds to the plan. There was a lot of litigation over that. There was an amended plan that was reached, and there's a disagreement among the states over what should happen to the additional funds, whether they should be given to the states that objected to the plan or shared amongst all the states. So there's some disagreement there. That could hold up the flow of those funds, and it could change how the flow occurs. But it won't cause it won't eliminate the flow. It just might slow it down.
Thank you. And I know this has to do with the Purdue bankruptcy, so I appreciate you indulging those questions that I had from yesterday.
Sure. It's been another really a front in the litigation. We've been quite involved in that, and happy to answer whatever questions you have.
Vice Chair Edwards.
Yes. Are there municipal litigation activities going on as well as the individual counties around the country?
There are within the multi-district litigation, which is what you're participating in, there's a large number of both cities and counties, and there's some other subdivisions as well, including school districts and some hospital associations and things of that sort. There are also cases that were not consolidated into the national litigation. So there are some states in which local governments, whether they be cities or counties, have ongoing litigation against the same defendants as well. That's not occurring in Washington. In Washington, all of the entities that filed suit are in, other than the state attorney general's own suit, are in the multi-district litigation.
So when this is all done, the attorney general here is going to settle his own litigation, and the beneficiary is going to be the state of Washington. Is that it?
That is certainly, I think, a fair description of the attorney general's ambition. Yeah.
And then we, as counties and other cities, are kind of doing this, and we're going to end up with something based on population, or is that kind of the way it's going to pencil out?
You know, the metrics that have been used in all of the various resolutions around the country and in the multi-district litigation are based on a matrix that is an effort to identify harm. So there are, in the national deal that Washington is not participating in, for example, and in the Purdue deal, the metrics, they relate to population, but they have to do with the number of pills that were shipped to that area, the opioid use disorder rates in that area, and the mortality in that area. And we put those things together, and the goal is to steer the funds to everyone, but focusing on the hardest hit regions. All of those metrics are obviously related to population as well.
I suppose somebody's gathering that information. Like, I think last year we had 48 overdoses, just a number off the top of my head, that had to do with opioids, I believe, just in Thurston County. So, I mean, I suppose bigger counties had more, I suppose, and those numbers will all be taken into consideration, I guess. Is that it?
That's correct. The numbers are tracked. The statistics are available at a local and national level, and they're taken into account in the allocation discussions. But again, it's not, the goal has been, because some rural areas are really, really hard hit, even though they have really small populations. And so there's been an effort to sort of balance out the allocation so that so that's taken into account.
Is one final thing here. Is there some central repository for that information that might be utilized that's not confidential? And I guess what I'm wondering about is, say if I was to go up to the legislature to talk about a legislative issue using this and be able to refer, well, we've had X number of deaths and X overdoses, that type of thing. So is there a central repository of that information here locally?
That's a good question. I know that it's tracked by county health departments, for example, and Thurston County may have tracked that information itself. And I know the information is reported up so that it's available on a national level as well. I can look into what we've been using, for example, and share that with you if there's some already put together public source.
Yeah, if there's, just let Scott know or something so we could be able to reference it possibly. Thank you.
Sure. Yeah.
Okay, thank you, guys.
All right, thank you.
Thank you.
Moving on, item 5 is natural gas appliances and indoor air quality. Art Starry, Environmental Health Division Director from Public Health and Social Services, here to present this item. Good afternoon.
Good afternoon. So you've had a long day, so I'll try not to talk about some of the other things you've had earlier, but I do have some interesting information about natural gas and some indoor air quality impacts that the use of natural gas has, and in particular, and some of the folks who it most or has the greatest effect on them. And I'll have some slides here, I guess, in a second, so I will share my screen. So hopefully you can see that. And when I was asked to do this, I was kind of wondering, it's like, well, you know, what am I trying to do? What's kind of the issue here? Because we have natural gas at our home, and when I think of the stove, it looks like, gosh, it's really clean air. It's not really a particular issue. I'm wondering what the concerns are. But when you start to look more at the issues and some of the current literature that's out there, you can find that, you know, I guess not really surprisingly, that when you have something, when you're combusting a gas within a kitchen environment or somewhere else in a home, there can be adverse air impacts, and there can be compounds that are being released that might be of concern to people. So if you look at the list of things that comes out, you'll see, not surprisingly, that there's things like nitrous oxides, carbon monoxide, which is a common combustion product. People probably think about that from exhaust from cars and things, and recognize that if you, at least in the old days when cars were not quite so clean, that if you parked a car in a garage, there was always a concern that there'd be adverse impacts to someone who might be in there. There's nitrogen oxides, NOx or nitrogen dioxide is a common one. There could be small particles that are emitted when you combust gas, natural gas or LP gas within a home or any sort of environment. There's even formaldehyde, and there's some other things too, but these are the common ones that have health effects. And when you look at all these sorts of things, there's two that come into play as kind of being the most significant ones. One is carbon monoxide, but the other is nitrogen oxide, or sometimes it's called NOx, but it's also nitrogen dioxide or NO2, depending on the studies that you're reading. You'll find that, again, that's really of concern. And the reason it tends to be is because it's produced at higher concentrations, and in particular, in surrounding areas or the cooking area where stovetops and ovens, the concentrations can be quite high. And the impacts are, again, fairly significant. I kind of glossed through that first slide that talked about the different impacts of some of those other contaminants. But when you look at nitrogen or nitrogen oxide, you can see there's some pretty significant ones here that they can contribute to asthma in children. It doesn't take a whole lot of increase of nitrogen oxide within an environment to start having significant impacts on children or anybody who's in that environment. Small increases in the neighborhood of 5 to 15 parts per billion, which again is a very, parts per billion, teeny tiny amount, can result in increases or impacts for asthma, wheezing, increased need for medication. And when you're looking at the background levels that you would expect to be in a home, that's maybe 8 to 25 parts per billion. I've got a slide next that shows some of those levels. And it also can cause more significant impacts, ranging from cost and chest tightness to severe illness, and even chronic obstructive pulmonary disease. And so That tends to be the concern. And when you look at the areas or the things that produce these nitrogen oxide things, it tends to be cooking. And the reason this is something that I knew, but it didn't really strike me until I was reading through the different materials on this, is that the reason it becomes a problem for stoves is because of the way they're vented, or in many cases, they're not. The building codes in most areas don't require direct venting of stoves. They might require a vent that pulls the air in and then pulls it from the cooking surface and then redistributes it through the house through a screen. It might have a big vent somewhere that's not directly exhausting the fumes and the gases directly outdoors. It may just distribute them throughout the house, or it may require even like a window or a ceiling fan that will pull air out. But in the meantime, the materials that are being emitted or burned can get to high concentrations, high enough that they cause public health symptoms. And so, for instance, there's a lot of studies, and some of these are older and some of them have been recently redone, show that stoves can have 50 to a 400% higher average nitrogen dioxide concentrations than homes with electric stoves. So, and that the concentrations that you can see for kind of common things like baking a cake or roasting meat in an oven can easily exceed 100 parts per billion. And if you look at the standards when they exist, that's well above the indoor air standard that Canada recently developed, which is 90 parts per billion, or the outdoor standard within the United States, which is 100. These are the thresholds where you would start to see greater populations with adverse reactions. What's interesting is that we don't actually have an indoor air standard adopted in the United States. The World Health Organization has one, Canada has a recent one, EPA has an outdoor one, but we don't have an indoor standard. So that's a little bit confusing. But you can nonetheless see that the common activities within a home can easily exceed what the outdoor standards or the standards that Canada has for indoor activities. And these are ranges. There are some studies I found that had found nitrogen oxide levels quite a bit higher than those. And the reason that stoves tend to be the kind of the chief concern is, as I mentioned before, is that there are not requirements necessarily for venting them. Water heaters and furnaces, if you have a gas furnace or you have a gas water heater and you go and look at how it's installed, you'll see that there's actually direct venting to the outdoors. And that's quite effective as far as removing any sort of combustion products or gases, so they get taken outside where they are not going to have the impact on the residents or the people who occupy the living space within a home. And so, again, this slide here shows that there's quite a bit of nitrogen oxide, again, that can be released as a part of cooking. When you look at the other compounds that I showed on that first slide, or actually the second slide, they don't get to very high levels. The second most important one wouldn't be, I guess, isn't surprising, as carbon monoxide, but it isn't produced at levels that are as nearly as high a concern as what we were seeing with nitrogen oxide. So that's, again, the focus for that. There's other studies that have looked at this. There was this slide over here is a new one that was produced by, I believe it's Stanford, and they measured impacts within a stove, or a cooking area within kind of some test kitchens. They found out that these different nitrogen levels are well above the standard that's the WHO standard of 109. But you can see that they're well above that in their study areas. In this case, they found some nitrogen oxide compounds that were well above 800. And again, here's the references that I was able to find. California has a state standard. There's an outdoor standard for EPA. This one shows the Canadian standard at 60, so I'm not quite sure. I guess one's indoor, well, that's the 1 hour average, which means kind of short time. And then there's another one here. I'm not quite sure why those numbers are different. I probably should research that a little bit more closely. But nonetheless, you can see that these studies, again, recent studies done by very reputable universities and states have shown that we have elevated levels associated with that. And again, the reason for concern is that people who are sensitive, particularly children, can have adverse consequences if they spend a prolonged time, in the vicinity of the area where the nitrogen gases are being produced. This slide shows a little bit of information about, again, why children face the greatest risk. There's studies now, again, that show that children who live in a home with gas cooking, especially one where there's not proper ventilation, they have an increased risk of having asthma, both immediately, in other words, current asthma at the time that the time they're living in the home, and over their lifetime, they have an increased risk of asthma as well. And so for people who've had asthma or who have family members who've had asthma, that's a big deal. It's certainly more than an inconvenience. And again, here's some reasons why children tend to be more adversely affected, or can be, is because they have higher metabolism rates. Their kind of body size to lung area is different, so they have higher lung surface, which means that a greater percentage of their they can have a greater impact by things they breathe, and then they're developing respiratory systems, and so those all can contribute to the impacts that gases, and any gas, but in particular the ones that we're talking about here, the indoor pollutants associated with cooking and things can have. And so in addition, so those are general concerns, but there are some populations or some areas where you might expect greater concerns. And it can be particularly the case for folks who either have greater populations living within a home, or maybe folks who have less income typically. Some factors that can contribute to their why they might be of greater concern is because they might have a smaller home size or kitchen size. So here's a picture that was in a document that I found. It shows what might be an apartment kitchen. Again, relatively small stove, not direct venting over the stove, but instead it's up here in the corner. You might have more people living in the home, so there's more people to be affected by cooking. Maybe there's more cooking taking place if you have a greater population within the home. Again, if you don't have adequate stovetop ventilation, then the gases can make their way throughout the home or the kitchen. Some of the studies show that the gases associated with cooking actually make their way throughout the home. So not just the kitchen area, but maybe into the living room or other areas that aren't separated from it. And then a lot of not surprisingly, that maybe older homes or older rentals have older equipment. The types of ignition systems that are used for gas appliances can make a difference as to how much gas they release and how complete the combustion is. And so that can have an impact as well. So if you have an older appliance, you might expect to have greater air quality concerns associated with it. So is this making any sense so far? So far, so good.
So far, so good.
What can we do about all this? There's a whole variety of things, and sometimes you'll see that some cities and things are taking this on as far as even bigger policy changes for considering whether or not new homes should be required to be electric or not. So we won't go so far into that, but there are things that folks can do if they have gas stoves and they're concerned about it. One is to make sure, try to reduce the gas oven use. There are alternatives you can do. There's electronic cooktops or things that you can use. You can make sure that use things like electric kettles or toasters or microwaves rather than using your oven or the gas portion. Ventilation is really important. If you've got especially a vent or a window that you can open, ventilate, an overhead fan that works, or vent that exhaust to the outside, make sure you have it running when you're cooking. After doing this research, I had a discussion with my wife to make sure that we turn the thing on more often, things like that. So run the ventilation system for 5 minutes after cooking. Make sure that the vents and the screens and things that are up in there are cleaned periodically. I know in ours, it's got a mesh screen that basically helps trap grease and stuff so it doesn't get caught up into the vents, but that clogs over time. It can get dust on it. That impedes the ability of the vent or the fan to work. Again, open windows if they're in the vicinity of the cook area to make sure that you have proper ventilation. Make sure that you have carbon monoxide detectors in the room. That won't deal with the nitrogen oxide, but that will tell you if there's carbon monoxide there. If they start to go off, then that's telling you that you need to do something to improve your ventilation, or a reminder that you might need to do cleaning or things. And keep your stoves and ovens in good condition. There's a lot of adjustments. I know with our stove, there's little things to adjust the burners to make sure they're set up right, so they're nice, clean flames as opposed to ones that are inefficient. So check out your manual, make sure that you got it set up right. If you have questions, maybe have someone who's got expertise, a repair person, come out and take a look at it. And if you're concerned about this, or you've got the ability to do so, you might look at getting a different type of stove. So get something that has an electric option. Especially if you're having to replace it anyways, or if you have the means and you have a vulnerable person within your home, you might consider doing that. So that's a list of things. I know I was going kind of quick, but I know we're also running long and late in the day. But that's what we found out about stuff. And there's also some interesting dilemmas that are coming about as we're trying to look to make homes as efficient as possible. A lot of the times when you're making them, weather tight and airtight, you're restricting airflow. And at the same time, you're doing that for climate and to save energy. At the same time, if you have a gas stove and you're, having it emit things, you've got kind of a conflict there. So that's something where, I think in the folks who have the newer weather-tight homes need to be thinking about the ventilation and making sure their fans and things, or their exhaust hoods and things are working properly. So that's it. Try to kind of zoom through things again, recognizing time, but if there's any questions, I'd be happy to try to answer them. And I try to, again, focus on, I left a draft slide there. So anyways, try to answer any questions that you might have.
Commissioner Mejia?
No questions, Art. Thank you for the presentation.
Commissioner Edwards?
Art, the only thing I'd ask, is there a difference between like propane and, I don't know, whatever kind of gas you're talking about, LP or piped in gas? Is it all basically the
This would be
same?
natural gas.
Yeah, is it all about the same?
I believe it's about the same because when you break it down, the basic composition of any of those gaseous products is about the same. And But the majority of homes within our community use natural gas too.
Okay, thanks.
Thanks, Art. That was right on point. I appreciate we've got, a very interesting conversation going on statewide about, new construction and natural gas appliances. And this is one piece of that pretty complex puzzle, but I had seen some information just along the lines of what you presented, and I appreciate you kind of following up and laying that out for us. Anything, County Manager? Okay, thank you, Art.
You're welcome, thank you.
All right, next is item 6. It's COVID-19 update, kind of a looking forward approach, and we're going to have Dr. Abdulmalik walk us through this last substantive item on today's agenda.
Good evening, commissioners. I just wanted to take a few moments to talk a little bit about where we are with COVID-19, the big things that have changed, and where we're headed. So just in terms of what I'll be discussing, I'll be looking a little bit about COVID-19 transmission and vaccination, and then I'll take a few minutes to flesh out what has changed significantly. As well as looking forward in the pandemic, what our next steps are as a department. So first things first, I just want to talk a little bit about how far we've come. So as of right now, we're at 105.8 cases per 100,000 over 14 days. And 43 cases per 100,000 over the past 7 days. We've had multiple waves and have just come off the Omicron surge. We've seen this pattern echoed in our hospitalization data, with 10 new hospitalizations reported in the past week. But overall, we're seeing a downtrend in hospitalizations that's matching our downtrend in cases. We're also seeing that deaths are a little bit trickier just because we count deaths as we process whether they are attributed to COVID-19 or not. So there's much more of a lag time. But overall, you can see that there's been a significant downtrend in overall COVID-19 related deaths, which we would expect with the downtrend in cases and hospitalizations. So when we think about the future, I've received a lot of questions about what are the currently circulating variants here in Washington State. So this is taken from the most recent sequencing data report that was released last Wednesday by the Washington State Department of Health. There is a little bit of lag time in terms of sequencing, just because it's a test that takes a bit more, that just takes more time to run. So that's why you'll note a little bit of lag time on the dates. But what you'll notice is that we are seeing predominantly Omicron, which is the BA.1 variant. However, there's an increasing percentage of the BA.2 subvariant. In general, what we know about this variant is that it's more transmissible than Omicron. However, in terms of the population level safety signals, in terms of disease severity, we haven't seen a significant increase in severe disease with this variant. We do continue to watch it. As far as global trends, it's a little bit hard to predict because we're seeing different patterns of transmission depending on what, the specific experience of the country with the Omicron surge. So while South Africa had a large Omicron, so BA.1 predominant surge, and did not see a large surge with BA.2, Denmark had a more modest Omicron BA.1 contribution to their surge, which was driven in part by BA.2. And then there are other countries that have seen two peaks, one for BA.1 and a second peak for BA.2. We're watching closely in terms of, so here in the US, a lot of the BA.2 transmission is occurring in the Northeast. So we're watching some of those patterns as well. But it's too early to tell what that will look like here in Washington State and then in Thurston County. Thinking a little bit about the aspects, the things that we can do to prevent transmission. And when we think about elements that impact the potential for COVID-19 spread over time, vaccination is incredibly important. So 71.7% of our total population has initiated vaccination. So that's at least one dose. So we're talking almost 209,000 Thurston County residents have had at least one dose of a vaccine. In terms of total individuals who are fully vaccinated, that's a little bit lower at 64.9%, or approximately 189,000 Thurston County residents. We are right at the state average in terms of individuals who are eligible for getting a booster dose, who have received a booster dose. And what we've seen with Omicron, and there's what we've seen with the Omicron variant, and from the preliminary data that we have, very preliminary on the BA.2 variant, booster doses are really essential in terms of preventing transmission for these more infectious variants. So that's the state of where we are. I wanted to take a few minutes to discuss what the major changes are in the way we're thinking about the pandemic, and the way we're supporting our communities through it. So we've had a number of significant changes in the last few weeks. The biggest one being the changing in the masking requirement. So prior to March 12th, the guidance was for folks to wear masks in indoor public spaces. And after March 12th, the Secretary of Health's order really limits masking limits required masking to healthcare settings, long-term care settings, and the correctional setting. There is a federal public transit mask requirement, and Labor and Industries has sector-specific guidance. And really what this means, and this is indicative of an overall trend in the COVID-19 pandemic, is it's moving from requirement, requiring specific mitigation measures to having resources available. So like the COVID-19 BOH dashboard, where individuals can look at COVID-19 transmission in their communities and then make informed choices. So knowing themselves, knowing their community and the people that they may come into contact with, and their own risk factors and the risk factors of those, those that they come into close contact with. Individuals can make choices regarding their masking. So there's been a significant change there. This has also been echoed in some of these other changes that we're seeing in the more direct mitigation and investigation priorities. So we're moving towards looking, so while it's still absolutely essential that individuals who have COVID-19 symptoms get tested and stay home, a lot of the focus for public health is really on outbreak and cluster investigations where there are signs of ongoing transmission and spread, as well as focusing our case investigation and contact tracing efforts really on high-risk settings. So settings where there's either a high risk of ongoing spread, like congregate shelter settings, or high risk of severe disease, where there are groups of people who may be immunocompromised or have other risk factors that would make them, which would give them a higher likelihood of becoming of having severe illness if they became infected. So the other piece that we're looking at is continuing our surveillance for those with unusual illness presentations. A lot of what we look at for that, in addition to provider reports of new or unusual symptoms, would be an increase in unexpected, a case in which someone experienced an unexpectedly severe illness is the other piece that we're looking at. So we're moving from the case investigation and contact tracing, which has been the backbone of the work that we've been doing, and moving towards looking at transmission risk and those who are most severely at risk. Along with this, as our COVID-19 efforts change and as our case counts have dropped, we are working through our demobilization plan. So thankfully, we're in a space now where we have fewer cases, and we are targeting our investigations to high risk settings. And so we're in the process of having a thoughtful and a stepwise approach to reducing to demobilizing our team while maintaining enough staff to go ahead and participate in those high risk in those settings where their work is needed. So thinking through those case investigations and contact tracing that we've talked about, as well as other pieces of work that will need to continue. So some of this plays into our next steps. So we're continuing to support community partners, and we're providing technical expertise for COVID-19 mitigation. So we get lots of questions, somebody tested positive, what are our next steps? Or we have a cluster, what do we need to do to stop transmission in a particular setting? We're continuing to support the distribution of testing materials. So in alignment with some of the pieces where, in alignment with the overall goal of moving, of empowering individuals to to take appropriate precautions. We along with, in partnership with the Department of Health, are able to provide over-the-counter testing kits to community partners throughout our county to increase access that folks have to those sorts of tests. We're also supporting our community partners in their vaccination efforts by serving as a COVID-19 vaccine depot. So what that means is that sometimes COVID-19 vaccine comes in large quantities, and there may be smaller providers that might not be able to use a quantity that large in the time frame that's in the manufacturer's time frame. So we act as a vaccine depot to maximize access that our community partners have to the vaccine. We are currently awaiting vaccine recommendations for the 6-month to 4-year age group. So that's the last big group that we're anticipating at this point for COVID-19 vaccination, and we are hoping to have some. So currently the timing really looks like late April, early May, but as we've seen with everything, these specific timelines can definitely change. We're also following the FDA and Advisory Committee on Immunization Practice, which is part of the CDC, as guidance is updated. So thinking about as booster doses roll out, there's been changing guidance on if somebody is immunocompromised, gets a third additional dose, when do they need to get a booster dose? So we're keeping tabs on all of that, and we're able to support, we're able to support community partners in terms of that information as well. We continue to monitor transmission patterns within the county, and we are so fortunate in Thurston County that we've got great local, state, and federal partners, which we're continuing to collaborate with. So this is the 10,000-foot view of where we are, where we're going, and some of the key pieces that are on the horizon. And with that, I am open to any questions you may have. Thank you so much.
No questions. Thank you.
No questions.
This is maybe something you don't track, but like in terms of international travel and kind of where the directions that's headed, I mean, I haven't heard anything recently about Canada and international commerce, and are people freely traveling back and forth from Canada right now under Canadian and American restrictions?
So at this point, I know that that's on the, I know that's been discussed. I would have to take a look at where we stand right at this moment.
I just thought you might know. Okay, I was just curious about that. There's been a lot of, I know there's a lot of pent up desire, not just desire, but need for travel that's been, kind of pulled back for various reasons, whether it's family related or economic, business related or whatnot. And Canada is obviously our closest partner, but I know there's a lot of other people that are not sure, you have to make travel plans. Most people need to make travel plans many months in advance, financially and schedule wise, and kind of not knowing, I have no idea where that's all headed, but okay, well, that's no other questions from the board. Interim Public Health Director Chavez, no? Okay. Okay, thank you, Dr. Abdelmalik. Let's go to our last items here. We've got Board of Health members' reports before we go back to Dr. Abdelmalik for her health officer report. Commissioner Mejia.
I've just been taking up concerns in regards to COVID, and then what I mentioned earlier on in regards to a permit concern from some people. And so I know County Manager Chavez is looking into it, as well as Art. So more to come on that issue.
Commissioner Edwards.
No, just the COVID issue kind of as my seatmate mentioned, there's still a lot of questions about why we're doing what, when we're gonna do something else, what's next. So,
Okay. My activities related, I've been to multiple implementation meetings regarding the Board of Health expansion, 1152. And as I joked a couple weeks ago, spent some time in the Yakima Health System, understanding, seeing how their system works. And that was very informative. So with that, let's go back to Dr. Abdulmalik for her general monthly health officer's report.
Good evening, Commissioners. So I would just like to begin my report by talking about the other communicable diseases that are not COVID that we've been investigating throughout the county. So in the month of February, PHSS staff have investigated 70 confirmed and suspect cases of other communicable diseases, which would include Campylobacter, as well as STDs, chronic hepatitis, as well as highly antibiotic resistant organisms, psittacosis and syphilis. We continue to have low levels of influenza in Washington State. And in Washington State, there have only been 5 confirmed influenza deaths for the 2021 to 2022 season, and only 1 influenza-like illness outbreak at a long-term care facility. Which is definitely reassuring. In terms of our syringe services program, they are working to expand rural services and will be offering a harm reduction 101 training in May to community partners. As far as environmental health, there have been ongoing efforts, so working with restaurants on food safety issues and addressing those issues. As well as investigation of Legionella cases. So Legionella is a bacteria that can cause a type of pneumonia. So this is also known as Legionnaire's disease. And so people get sick when they breathe in small droplets of water or accidentally swallow water that has this bacteria. And this bacteria gets into their lungs. So one of the pieces that our environmental health team is working on is taking appropriate samples to promote the overall health of the public. And with that, I will keep it short and sweet, but I am happy to answer any additional questions. Thank you so much.
Any questions for the health officer? Nope.
no, sir.
Thank you, ma'am. Let's go to, so our interim public health director is not available for today's meeting, but county manager, anything that you'd like to report on his behalf?
Yes, thank you, Mr. Chair. Just to make it quick on additional reporting, this is from the Office of Housing and Homeless Prevention. The office conducted the annual point-in-time count of those experiencing homelessness in Thurston County in the night of February 24th, 2022. Surveys are being tabulated, and the preliminary results will be available in early April. Also, the office issued requests for proposals for 2022, making available over $2 million in funding through the Community Development Grant Program, as well as the funding for affordable housing projects, cold hazards, weather activities, and other homeless services. And also related to the treatment sales tax, the Public Health and Social Services staff has issued a call for treatment sales tax advisory committee members' applications to fill vacancies, in addition to the several committee members who are requesting reappointments. Also, the treatment sales tax staff will moderate a community forum about programs in the Thurston County Jail and therapeutic courts that are designed to connect people with mental health and substance abuse disorders with treatment and other services. The forum is sponsored by NAMI, Thurston County, and NAMI of Thurston County, and Justice No Jails, and will take place tomorrow, March 23rd, 2022. It is the second of a series of 3 forums in the related topic. And just to make it quick, that's all I have.
Questions for?
No question.
Okay, next Board of Health meeting is on April 12th. And with that, we're adjourned. Thank you.